On today's Two on Your Side town hall, medical experts and state officials are urging people to stay safe this holiday season when it comes to large gatherings and COVID. We're going to talk with a local infectious disease expert about a few different topics today. Plus, Kwanzaa is now underway. We're going to speak with an author and speaker who focuses on African American history, about the cultural celebration that continues today despite another year of the pandemic. And Bills fans waking up with a smile on their faces this morning after a big win in New England brings us this Victory Monday. We're going to talk about what now lies ahead with our Bills insider, Vic Carucci. Thanks so much for being here for the town hall on this Monday. I'm Kate Welshofer. Michael is off tonight, and we do have a few different topics to get to tonight. We're going to start with the pandemic. Today, Governor Kathy Hochul held a briefing to talk about the state's latest efforts to slow down the spread of new cases. And much of that strategy revolves around making more tests available to New Yorkers. She says more than 150,000 tests were administered by the state this weekend, and 1 million more are on the way. With Christmas now behind us, but New Year's still to come this week, we have plenty to talk about with Dr. John Sellick. He is UB's Jacobs School of Medicine with a specialty in infectious disease. Dr. Sellick says with the colder weather already helping spread the virus, the amount of gatherings over these few weeks of the holidays is always cause for concern about the increased risk of infections.
This is definitely going to be a challenging chunk of time. And most of us are expecting we will see a surge probably starting in the first week of January. The problem that we have is large numbers of people getting together for either Christmas or New Year's, office parties, whatever the case may be. And you don't always know who is vaccinated and who is not vaccinated. So I think the advice that if you can, restrict your socializing to very small groups of families and close friends where you know that everybody is vaccinated and boosted, the risk goes down. If you're going to go out to a large New Year's Eve party where there might be 30, 40, 50 people, there's definitely going to be increased risk with that. And I think we probably saw that a little bit with Christmas as well, as we start to see cases coming in this week.
And today, Governor Hochul said the state administered 168,000 COVID tests over Christmas weekend. She says the state has ordered another 37 million tests. And Dr. Sellick says while increased testing is a good thing, not all testing methods can provide the same information or the same peace of mind.
Our ability to get people in to get vaccinated now has slowed quite a bit. That has still not stopped most of us from continuing to try to get people in. The issue of testing is a little bit complex. Certainly the PCR tests are the best. The rapid tests can provide some information, but they really need to be used serially. So, if you are out, let's say you go out on Wednesday with the guys that you play ball with, and then Thursday is going to be an office party, and Friday you go to one family event, and then Saturday you're going to see grandma, and you think that taking that test on Saturday morning is going to make it safe. It may not make it safe. I think that the best use of those tests is to do at least a couple of them, maybe even more. Say maybe the day or two before whatever your event is, and then the day of. And if all of those come up negative, it gives you a little bit better idea that you're probably not infectious. So the testing piece is, like I said, a little bit complicated, and it has to be done the right way.
And we also wanted to talk about schools as well. While students are off for break until the new year, we expect to hear from Buffalo schools tomorrow about their safety plans to return kids to the classrooms. And we know the state and all of our local districts have emphasized the importance of in-classroom learning. Dr. Sellick says it will be tricky if there's an uptick in cases after the holidays, but believes that districts will have several options ready to go come January.
That's going to be a challenge for the health department, for the schools. I think that, again, it goes back to what everybody's behaviors are. I think that if you have families who are not taking undue risk and making sure that any of the gatherings are only with vaccinated, boosted people, then that risk will be somewhat mitigated. If everybody is, just behaving like this is pre-pandemic, then it's going to create a bigger problem. And certainly we've already had the whole discussion over test to stay, which has worked well in other places in the country. But again, it's that same idea. It's not just a matter of taking one test the day before you go back. This needs to be serial testing, probably every other day. You would want to see maybe at least 3 times in a week with all the kids wearing masks. So I think that we'll get a little bit better sense over the course of the next week as far as how our local caseload goes, about how well that might work. And certainly I would presume that most of the school districts have alternative backup plans if this doesn't go well.
And we closed our chat with Dr. Sellick by asking for his closing message to those Western New Yorkers who are either unvaccinated or have yet to get a booster. And he said that message remains the same.
If you're unvaccinated, please get vaccinated. This is an incredibly safe, incredibly set of vaccines. Get one of the mRNA vaccines, either the BioNTech, Pfizer, or Moderna. If you've already had your 2 doses and you have come to the time where you're eligible for a booster, please get that booster, because what we're seeing is that, especially with Omicron, that booster will not prevent absolutely every infection, but it is preventing the most severe infections. And that's what we're really looking for. We want you out of the hospital and out of the morgue.
Dr. John Sellick is an infectious disease expert with UB's Jacobs School of Medicine. And as always, we appreciate his perspective as we expand on the day's COVID headlines.